Hi friends, welcome back to USMLE team. Today's topic is classification of antiarrhythmic drugs. Right now I'm discussing about the drugs, about the USMLE step 1 pharmacology. So before starting this, I would request you to subscribe to our channel, that is All Unknown Law, and please tell your friends to subscribe. Okay. This is about the general idea, and regarding the individual and the important drugs for USMLE examination, I will discuss separately. Okay, let me start with this. Try to concentrate on this. This is very important what I'm talking right now. Okay, this is about the action potential, right? So this is about the action potential. You have the different stages from 0, 1, 2, 3 and a 4. Okay, so this is about the look at the position, look at the stage in which the following the electrolytes act and causes action potential. So if you block the following channels, then it helps you in the treatment of arrhythmias. So from 0, 1, 2 and 2, 3 and 4. Okay, so these are the class. We have a different classes. Right now I will discuss about this. Okay, so we have a very the antiarrhythmic drugs that blocks sodium channels. Okay, the potassium channel blockers. Okay, so these are very important I'm talking about right now. Okay, look at this. This is the class 1, class 2 here on the 4 side, class 3 and class 4. Okay, so class 1 we have a different class 1A and class 1B. Okay, so regarding this I will tell you about different classes later. In a class 1A we have these drugs blocks the fast Na plus channels. Okay, preferentially in the open or activated state dependent blockade, what we call, and there is an increase in the action potential duration, that is the APD, and effective refractive period ERP. And also these drugs class 1A also blocks the potassium channel, remember. Okay, K plus channel they also block. Okay, the drugs included in this are quinidine and procainamide. Procainamide is a very important drug for your USMLE examination. I will discuss later. Okay, then class B, 1B, we have an antiarrhythmic that block again the fast Na plus channels, block inactivated channels, whereas preferentially the class 1A preferentially in the open and activated state and a state dependent blockade. Okay, that's very important. And a block inactivated channels, preference for the tissues partially depolarized, slow conduction in hypoxic and ischemic tissues. This results in an increased threshold for excitation and less excitability of hypoxic heart muscles. There is a decrease in the APD. Okay, here in the class 1B due to block of slow Na plus channels, but this increases diastole and extends the time for recovery. So try to, because in class 1A there is an increase in the action potential duration. Okay, in a class 1B there is a decrease in the action potential duration. Okay, these are the basic ideas about the class 1 and the class 2. Okay, let me move on to the next slide. The drugs included in this are class 1B is a lidocaine, mexiletine, tokenide. Okay, so there are the lidocaine is very important drug for USMLE examination, and there is also in a class 1C that blocks again the same fast Na plus channels, no effect on APD, that is the action potential duration, no effect. First one, class 1A increases the action potential duration, class 1B decreases the action potential duration, whereas the class 1C does not have any effect on APD, that is action potential duration. Okay, the drug included in this is a flecainamide. Okay, sorry, flecainide. Okay, okay, now we have a class 2. Definitely you know very well class 2 is nothing but a beta blockers. Okay, though they prevent the beta receptor activation, which would normally increase in the cyclic AMP, and there is a decrease in the SAA node, SAA and AV nodal activity, decrease in the slope of okay, phase 4, what you see. Okay, this is a class 2. Phase 4 is a class 2. I think it's a blurry, but you can make it out. Okay, the drugs included in this group are propranolol, okay, esmolol. Okay, and class 3 are the potassium channel blockers. Class 3 are potassium channel blockers. Here you can see potassium channel. Okay, potassium channel blockers they decrease the potassium slowing phase 3 of action potential, increase in the APD and ERP. Okay, especially in a Purkinje and ventricular disease. So the drugs the important drug in this class is amiodarone. Okay, this is very important drug. It's this the peculiarity, the beauty of this drug amiodarone is it can mimic, it can act in a different classes also, like 1, 2, 3 and a 4. Remember, though it acts by blocking the potassium channel, but it also can be in a different classes like 1, 2, 3 and 4. Okay, it increases the APD and ERP in all cardiac tissues. Okay, so this is very important, and I had discussed about the importance of amiodarone, and very important drug for your USMLE examination. And a class 4 we have calcium channel blockers. Okay, here you can see calcium channel blockers. They block the calcium channel of cardiac muscles. There is a decrease in the zero phase and as what you call phase 0 and phase 4. Okay, so phase 4 also remember. Okay, let me start with this. Okay, let me move on to the next. They can also block the phase 4. Remember this calcium channel blockers. The drugs included in this are verapamil and diltiazem. Okay, here is a classification of the drugs. I discussed about this. This is a brief idea, you can get it from this beautiful table. Just go through once. Okay, so look at the 1A, 1B, 1C, 2 and a 3. Okay, we have different 4. We can include calcium channel blockers. If they don't include, it's okay. You can include in the calcium channel blockers a 4th class. Okay, so they decrease the phase 0 and phase 4. Remember, look at the drugs included and look at the important drugs is procainamide, very important, you should know. Beta blockers, amiodarone, satolol. Okay, so try to memorize these things. Okay guys, thank you so much for watching my video. Take care.